Dr. Oz here, and we're sitting here with Phil. And today we're basically going to be talking about some of the non-invasive treatments that we have, such as cupping, the Class 4 therapeutic laser, and some of the Graston technique that we use here. So since Phil has been sitting out there in a fixated position on the computer, basically sitting like this all day, we are basically going to try and reverse everything. So Phil, let's start face down here. And the first thing, so obviously depending on the patient, the treatment is definitely tailored towards the patient, number one. But just since I've been working with Phil the past 2 years, we kind of know what's going on with them. So what we're going to start is with actually the Class 4 therapeutic laser. So do you feel comfortable if I pull your shirt up?
Yeah.
Alrighty. So when we do the Class 4 therapeutic laser, it has to be on skin. And then we have to use these protection goggles here too. So I will do my laser spiel here real quick. So how the laser works is just how sunlight hits a plant for the plant to grow and heal. And oh, cool, you guys can see it on camera too. So it basically just looks like a little red light there. And long story short, just how sunlight hits a plant for the plant to grow and heal, we are donating photon energy to Phil's cells so he could heal 100 times quicker than what he normally could. So that works on a couple different properties. So if we go back to 8th grade biology, the mitochondria, the powerhouse of your cell, basically what we're doing is the photon energy is entering the mitochondria of the cell and hitting something called a chromophore. It's a photosensitive receptor in the mitochondria, and it allows for an ATP production. ATP stands for adenosine triphosphate. What does that mean? That basically just means that he is going to increase and replicate newer and healthier cells in his body. So that's number one, what it does. Number two, it allows for an increase of nitric oxide and O2 perfusion across the cell membrane. So the O2 perfusion is going to deliver more oxygen to the cells in his body, and then the nitric oxide is going to be for the blood flow here. So, and this could be used on a ton of different pathologies. I have patients who come in just for the laser for their TMJ pain. I use it on any kind of disc bulge, disc herniation. And where we're getting actually a lot of relief is when people are having any kind of radicular symptoms. So that means any kind of neck pain running down their arm or any kind of low back pain running down their leg. And how that works is you have 3 channels on a nerve. You have a potassium, a calcium, and a sodium ion channel on your nerve. And the best analogy to explain this is if you are an individual that's suffering from any kind of low back pain running down your leg, or if you have a family member or friend that has that, think of a straw with a bunch of holes in it. It's basically like a leaky straw. So that nerve wants to keep firing. It keeps depolarizing and running down your extremity. What the laser helps to do is it actually helps to work on the calcium ion channel on that nerve. So it kind of plugs up the hole in the straw so you don't feel the radicular symptom running all the way down your leg. People are getting fantastic results with that. I also use this on a couple of people with diabetic neuropathy, pain in their feet. Double-edged sword though, we could treat the feet with the laser to kind of bring the nerves back to life, so to speak. But if your A1C is not where it needs to be, and if you don't change your diet or gone to any supplementation to kind of decrease your sugar, it's not going to work correctly. So we are actually getting great results with diabetic neuropathy patients, not only from the supplement protocol that we put them on, but also from the laser. Not too warm here? Okay, and lastly, the only byproduct from this Class 4 therapeutic laser is heat, just since it's such a powerful laser. So we actually use the heat in our favor. So once tissue, all collagen, gets heated to around like 100 degrees, it becomes a little bit more pliable or amendable. So basically when we heat all this collagen up in Phil's back, since he's kind of tight in his mid back there, think of all his fascia and his muscles are kind of intertwined. So this is basically your quote unquote trigger point here. Once we get everything heated up to around 100 degrees and we go over it with this Graston tool that we're going to use next, it's basically trying to get his myofibrils in his muscle and his fascia to kind of organize in a more linear fashion. And that will basically take out the trigger point and like that tightness when people were like, oh, I got a knot in my back. That's basically what we're trying to work on. So what I'm going to do is I'm just going to move this out of the way briefly, and I'm going to grab, it's called an instrument-assisted soft tissue mobilization. Looks like a glorified butter knife. And so what we're going to do is I use China gel, just basically to lubricate the skin so he doesn't get a lot of petechiae, it's called. And what we're doing is we're just basically going over the Oh, you're tight. All right. So Phil's been sitting in the same position here for what's today? Wednesday already? Yeah. Yeah. So in Phil's line of work, he's sitting from the computer a lot. And a lot of people, if you guys looked at my golf talk yesterday, everybody gets that. It's called an upper cross syndrome. So when you're sitting here, your deep neck flexors get weak. Your levator scap and your upper traps kind of get hypertonic, so they get very, very tight. Your pecs get tight, and you kind of take this posture right here. So what we're going to do is we're going to work on certain muscles on Phil to kind of basically reverse everything he's doing so he could get his shoulders back upright, and then in turn his neck will kind of come up in just a normal posture and not that antalgic anterior head carriage there. And so what happens when we do this Graston technique, any kind of muscle or ligament or tendon injury, people respond great from this, especially because the laser is going to decrease the inflammation, and how we were talking about heating the tissue up, it just becomes a little bit more mendable. So same analogy is if you're trying to bend cold rubber as opposed to warm rubber, it just works a little bit more efficiently if we get some blood flow to the area and just heat the tissue up a little bit here. And again, this varies per patient. Some patients, I'll use Graston on just because it works better for them, and then some patients I'll just use cupping on. It just all depends on what the patient's body's showing us here. So we'll just go a little bit more with the muscle scraping. And then there's a couple different ways that you could do cupping. Cupping's been around for thousands of years. And I think it got very, very popular when Michael Phelps was in the Olympics. When he went on his tear that last Olympics, he always had the cut marks on his back. That's the kind of therapy he got and he responded to the best. So we use that in here as well. So actually, that feels a lot better already. So what we're going to do next is I'm going to rest this down here, and then I'm going to grab these cups here. All righty. So we were talking about there's different types of cupping. So there's something called static cupping, and static cupping is just basically going to be putting the cup on the skin, pulling it up, and I usually walk all down this erector muscle. So it's called your erector spinae. It's the main stability muscle of your spine. So I like to kind of put the cups. I'm just not chasing pain. I like to treat above and below as well. So we're basically putting the cup on, and the way I use it is we're trying to pull the skin and the fascia off of the muscle so everything can breathe underneath. So when people are very, very tight like Phil, sometimes I'll actually do, it's called like a transdermal cup. So basically I'll have, sorry, my hand's cold over here, Phil. So we'll basically put a little bit of a lotion on, and then we could actually move the cup as well. I don't know, you guys could probably see this on the camera here. So this is just another way to kind of release tissue. And again, it's not a cookie cutter approach. It is basically tailored to the patient. Some patients respond great with static cupping. Some patients respond even better when we kind of get it mobile and kind of roll it over the tissue. And then the last thing that we could do for the cupping is cupping with movement. So people actually get great results if they've had any kind of chronic tightness. If you just put a couple cups on, and then we're actually going to have Phil do a couple cat-cow for us. So you guys see what that looks like. So let me put two more on here, Phil. And last one here. And so again, these are like the three main ways that you could kind of do cupping therapy here. So Phil, do you mind kind of popping up on all fours here for me? So, and then you're just, yep. And then just like that. And then you're going to do a couple cat-cow. So you can actually go on your, okay. Yep. And then do you know what a cat-cow is? No. So think of, here, I'll just show you off camera here real quick. So this is a cat-cow. You're going to go like this. Oh, I see it. And then up just like this. Yep. And I'm going to stand next to you here. All right. So, and this is basically the cupping with the motion. So you're going to drop your chest down. Yep. And then you're going to get long through your mid back. So think of someone with a string pulling you up through your mid back there. Keep going. And then let's go back down here. And we're going to go three more. So this is a little bit more of an intensive treatment. People do great with the static and then with the movement, but when you actually have the cups on to kind of lock down the skin and the fascia, and then have a patient actually go through the movements with the cups on, you get a lot more bang for your buck here. So we're going to go last one here and get tall, 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 tall. Okay, and you can relax. So you could go face down for me here again. So that, yeah. So that's in Phil. You feel those a lot more intense, yeah. And then sometimes patients will get it's called petechiae. So it's just kind of like just micro blood vessels. Sometimes you'll see some spots on their back, and Phil, you're going to be tattooed maybe for like 2 or 3 days here on the back. So that is basically the cupping therapy. And again, it depends on what the patient presents, depending on if we do one of those 3 different variations of treatments there. So, and then what I also like to do too is this is called a percussion device. It's kind of like a massage gun, and the reason why these work so well, when people are in the room, they're like, "Oh, just from using that massage gun, I feel so much looser." It's all neurological. So when you rapidly tap a muscle, you have something called a GTO, a Golgi tendon organ in the muscle. It sends a message to the brain back down to the muscle, and it basically forces the muscle to elongate and relax. So if anybody is extremely tight, I'll use this on them. And if anybody's ever like nervous, this is just a really good way to basically get their whole nervous system to kind of down regulate, just so treatment just works a little bit more efficient here. Too much pressure? And I honestly could probably lay on my belly for 5 hours a day and get someone to do this on my back. And unfortunately, I have one of these at home, and when I need treatment, it's usually always on a Sunday after doing something in my yard, and it's hard to treat yourself with this. Okay, so once Phil's nice and loose, we're gonna get his mid back adjusted before we flip him over, and then show how we were talking about getting his posture from this to kind of just more normal and correct, so his head kind of falls back here. So, Phil, you're gonna drop your arms down here for me, and then Dr. Orbach and myself do motion palpation. So we're basically trying to put just mild force into the joint to see what's stuck and what needs to move. Yeah, you're fixated up top. Okay, so let's go deep breath for me, Phil. And all the way out. Nice and easy here. Very good. And let's go last one for me. And all the way out. Nice and easy, Phil. Very good. Okay, and do you mind flipping on your back here for me? And let me get this head. Actually, I'm going to move this laser out of the way here really quick. All right, so we were talking about Phil being the season. Whenever I get new patients coming in here and they are basically working from a computer around 40 to 50 hours a week, you are basically just holding the same posture. Again, it's going to be that anterior head carriage, and everybody's going to be like this. So what we're trying to do is we're going to release Phil's, it's called his pectoralis minor here. Actually, it attaches to your sternum and then in your shoulder. So once we release this, his shoulder's naturally going to kind of go back. And again, it's going to kind of bring his head into the correct position here. So I'm going to take this arm and just real loose here. I got you. And when patients say they are sore the next day, I would say this is probably what makes them sore, because how we were talking about that trigger point, if you were basically doing the same repetitive motion or just sitting in a certain fixated position for hours on end every single day for multiple weeks and years, that tissue kind of gets stuck in its way. So we were talking about how we have that trigger point. Another way to release it is basically called active release technique. So we're shortening that muscle, pinning it, and then stretching it back out. And basically we're trying to just get that muscle a little bit longer. So Phil's shoulders, instead of sitting like this, they're going to just kind of come up and back here. So we're going to do a little bit more. And then since you are using your hands all the time too, we're basically going to work on these forearms here. And I treat Phil once a month.
Probably something like that.
Yeah, somewhere around once a month. And that's just the thing too. Everybody thinks that you only need to see a chiropractor if you're in pain. Myself and Dr. Orbach, it's just basically looking at the biomechanics. So you don't have to necessarily be in pain to come see a chiropractor. We're basically just trying to oil up the machine, so to speak. So we're just trying to enhance and just make everything better. And if anything, prevent something bad going on, because there's a lot of times when Phil comes and I treat him once a month where he's not even in pain. But how we were talking about, if you're holding the same position hours on end weekly, something's going to give eventually. So this is basically all preventative care for Phil. I think I only had to treat you twice when you had a flare, right?
Yeah.
It was wrist and forearm, I think.
Yeah, usually, I mean, there's sometimes like that. There was that one time where I had the thing in the calves.
Yes.
I was like walking downhill and my calves were just on fire walking down the hill.
Yes.
And I came to Dr. Rossi, did that. What was the name of that stretch that
we did the Cloud Walker.
Cloud Walker.
Yeah.
That's what it is.
Yep.
Yeah. And I was fixed up.
Yeah. The Cloud Walker, not a lot of people do that stretch. It basically works on, it's called your interosseous ligament. It's between the two bones in your lower leg there. And people who have any kind of shin splints, calf pain, that's a no-brainer. People get crazy response with that. So just like what we were doing with Phil's pec muscle, we're going to do with this forearm. So, and I actually tell patients to do this at home too, if you have tightness in your forearm. So you're going to shorten the muscle. So we're shortening his flexor muscles on the underside of his forearm here, pinning them down and then stretching them back out. And it's just going to make them a little bit longer here. And I usually do this with anybody with any kind of trigger finger. Carpal tunnel symptoms, depending if it's true carpal tunnel or if it's coming from their cervical spine. And I mean, I like to use this on golfers and then people who are working from a desktop computer. So we're going to work these puppies out. And I would say the most tender one is a muscle on the opposite side of your forearm. It's called your extensor carpi ulnaris brevis muscle. Why they just couldn't call it a forearm muscle is beyond me. But this is, I would say this one's the most tender on people. And so, yep. So same thing. We're shortening the muscle, pinning it, and then stretching it back out just to make the muscle a little bit longer. This muscle is a key muscle. And if anybody's ever heard of lateral epicondylitis or tennis elbow, basically what happens is these muscles in Phil's forearm get very, very tight and they pull on the epicondyle, which is basically the bone they attach to. So I call it putting more slack in the rope. The more soft tissue work we do to the muscles on his forearm, we're basically trying to loosen them up so there's not so much tension pulling off the bone where they insert and originate from there. All right, you can relax that there for me. And lastly, I think you want to get your low back adjusted? Okay, so you can face me on your side here. And usually every single new patient, we go through a full thorough exam. So we're checking neuros, orthos, and everything. We did not put this in the video. This was just for treatment purposes. But every single patient, we're going to basically go over vitals, comprehensive health history, and everything. This is 15 or 16 treatment for you. So we already know basically we've already assessed Phil and everything. So we're just going to get him rocking and rolling. So we're going to bend this top leg. I'm going to take this on. Big old pull. Did you burn yourself on your forearm?
I did.
Yeah, you did.
I did.
And just very easy here, Phil. You can just go real relaxed here for me. Easy, easy, easy. Perfect. Last one. Very, very good. Okay, let's go to the other side here for me. And this is just one way to adjust someone's lumbar spine or their SI joints. This is called diversified, but some people don't respond well to this. So we'll actually do another technique. It's called Thompson technique. There's multiple ways to treat patients. So that's why I love when people come in here that's never seen a chiropractor before, because they think it's just a cookie cutter approach. But myself and Dr. Orbach, everything is completely tailored to the patient. So we are going to grab this arm, big old pull, big old hug, and just easy here. Very easy, Phil. Last one. Very, very good. On your back here for me. And a little pull on your feet to make you just a little bit taller here. Little pull. Good. And last little pull here. Very, very good. Okay, so let's get you up, see how that's feeling. And that was kind of just a little rundown of, just a couple different things we do in the room. That is basically everything that I'll do to kind of treat. Again, everything varies depending on what the patient's presenting. And then I'm a huge advocate of any kind of home exercises and stretches. So not only are we going to get you, if you're in pain, pain-free in this room, we're basically going to give you corrective exercises that you could do at home to prevent the same thing bringing you in happening again. So what we would do in Phil's case, I don't know if I could show it on the table here. I was just going to show him maybe the thread, the needle, the open book. We'll make it work here. So very generic, just in Phil's case, where if he gets kind of like upper back tension, and we were talking about the shoulders rolling forward, head going forward, I like to give some mid-back openers. So one of my favorite ones and one of the easiest ones to do is called an open book. This is going to be modified because I'm on a smaller table, but you're basically laying on the floor and you are basically taking one arm and you're taking it all the way back and touching the opposite side of the floor. So this is basically called a thoracic rotation exercise. This is an open book. Another good one that people respond very well to is called thread the needle. So you're going to be on all fours and you're basically just going to slide your hand across the floor here and then kind of just drop your chest down. So these are two really good mid-back openers. And then my favorite one, this is actually this is from the TPI golf screen we do. You're going to start like this, and then you're going to take your arm all the way back and touch the opposite side of the wall. So these are just very generic stretches that could kind of start to get the ball rolling, so to speak. And then we'll give you corrective exercises you could do at home, whether it's with weights, kettlebells, resistance bands, and all that kind of stuff. So if you guys have any other questions, feel free to send me an email, or my lunch is any time from 1 to 2 p.m. Give us a call and we could talk about getting you on the schedule and getting you guys some relief and preventing any future injury. And that is basically my treatment protocol. Really quick there. Feeling good, Phil?
Feeling great.
All righty. Thanks, guys.
Thanks, guys.